My name is Dr. Laura Williams. I'm in Sacramento for a special conference on pediatric obesity sponsored by the National Hispanic Medical Association and Dr. Elena Rios. Join us as we go on this tour of our healthcare systems and the issues related to the Affordable Care Act.
We're discussing early childhood obesity today in Sacramento, and we are happy to have you here as one of our facilitators. And we've got about 80 people in the room who are really excited to discuss diabetes, obesity, all the related comorbidities today.
The obesity prevalence among low-income children, this is from the CDC, and you can see California has a very high percentage. The darker blue means the higher percentage of child obesity. In terms of the Institute of Medicine, which is a congressional mandated agency that advises Congress, their first report that talked about obesity was Health in the Balance in 2004. The recommendations included, one, that the federal government should make child obesity prevention a national priority. The White House Task Force on Obesity started in 2010 to bring together federal agencies to look at early childhood obesity, to empower parents and caregivers to have healthy foods in schools, access to healthy, affordable food, and to increase physical activity. And child and adult care programs, so for us, child care is important. We're looking at this age group of 0 to 8. Healthy food in schools was a big push under this administration. We were part of the advocacy for the law that got passed in 2010. And we're here really focused on what strategies can we all build to our communities that are poor, Latino, and others who are in our poor communities. The Department of Treasury has its own program. It's a community development financial institution initiative for banks in our communities to give funding to low-income nonprofit programs to help with food deserts. Increasing physical activity and decreasing sedentary behavior, especially in child care settings, and the built environment, meaning the places that you actually live and work, that we really should focus on more physical activity. And it's not the word exercise, it's the word physical activity, meaning taking stairs instead of elevators. We now know, the knowledge shows, the literature shows, that breastfeeding your child can eliminate obesity, or can be a factor to eliminate obesity as an adult. It's about communities coming together and deciding how they can change obesity. It's about having the community health centers of the country actually have a collaborative on obesity, so that different community health centers across the country have been working together to help develop curriculum for their own community health center staff. And in terms of just physicians in general, because our organization is about empowering physicians to work with all of our communities, to be spokespersons in our communities, that physicians overwhelmingly do want the healthcare system to cover the costs associated with connecting patients to services that address their social needs. We don't want to talk about the barriers, we want you to tell us what are the strategies. And our mission really is to empower the Hispanic doctors to improve the health of our populations. We also decided to establish our own foundation, which we call the National Hispanic Health Foundation, so that we could receive funding from the foundations of the country, like the Kellogg Foundation.
From the federal perspective, we're very aware of the fact that many of the decisions are being made at the state level. Health plans are going to offer 10 essential health benefits, and this is where the states are working really hard to define what these are. The federal government is not defining what the states are going to do around this. We've defined what these 10 essential health benefits are, and we know what it isn't when we see it.
Now, the Affordable Care Act certainly presents us with many different possibilities. First of all, we have the coverage aspect that tends to get most of the press. We're going to be expanding Medi-Cal to another 1 million people, 1 million more Californians. We're going to be getting them into a system of care through Medi-Cal or through the exchange, Covered California. We're eliminating pre-existing conditions, making it very important market reforms to ensure people can get the care they need, as well as ensuring that they get access to prevention and the opportunity to see all of us to try to get the counseling that they need as well, to help them with their diet, exercise, and management of their obesity. We know that there's unfortunately, even with the ACA, there's still going to be many people who still will not get health care coverage.
If we see a parent that is not eating right, it's also going to trickle down to the child, of course.
lot of times we make pass legislation, make rules, recommendations without really asking, the people that we're serving.
Have you ever looked at the school nutrition meal for the month? And if you look at it, you'll see that most of these children are eating what they shouldn't be eating.
Within our community, diabetes is rampant, cancer is rampant. So we're working with the young people to build a greater awareness, brain consciousness. We're working with the young people so they can be ambassadors to their families, to their communities. And then on the second day, on Thursdays, we do the exercise portion. So we have jiu-jitsu, we have soccer, we have boxing, we have Zumba, we have all the various different sources. So, and then we meet with the young people to make the show, to tell them that this is a holistic approach, and how it's a life change.
We're here at the conference because the childhood obesity has been a big community problem.
My concern is when they get home, right, the families may not be supportive.
A lot of mothers think that if the baby is a little bit overweight, he's healthy, which I try to explain to them that is not correct, but they don't really pay attention. Yes. So that we started to have more families now. They are all coming for health education. Right. And they want to know about how the other kids can lose weight too.
I feel very optimistic about how the Affordable Care Act is going to be.
I think I'm a little bit more inspired about the fact that there are others that value the work of the Affordable Care Act in terms of putting Latinos in a better position to embrace all the opportunities, like being able to enter health insurance enrollment, Medicaid expansion. It was wonderful to meet people that are going to actually go back to their communities and get the word out and work on also addressing childhood obesity in the Latino community.
I think that Dr. Elena Rios is right. It's a call to action. The time is now. If not now, when? And if not us, who? And we should all be asking ourselves that and do our part to make sure that the California community, particularly the Latinos, get enrolled in healthcare reform exchange and take advantage of the programs that are already being developed to curb childhood obesity. Yeah.
So you feel positive about the summit?
I'm very pumped.
Very pumped. Why you look pumped?
Oh, thanks.
The National Hispanic Medical Association and its foundation, the National Hispanic Health Foundation, were supported by the W.K. Kellogg Foundation. And today we got some support from the California Endowment to bring together about 100 experts from up and down the state of California. We were very pleased to see not only healthcare leaders from hospitals and clinics and doctors and nurses, but we had community leaders from our schools. Teachers were here, people from media, people from unions, people from nonprofit organizations, and lots of visionaries who have the same vision. In order to improve the lifestyle of Latinos in this state and in this country, we need to educate them on what it means to have healthy behaviors and what it means to live a healthy life, which means decreasing obesity. And the purpose of this conference was to bring together people to talk about how do we decrease obesity among early childhood, 0 to 8 years old, so that we could start young and start our community, not only the parents and the schools and the doctors, all working to have the next generation change the obesity epidemic in this country. And that's the only way we're going to do it, is by starting young. I think that it was a success, and we're very happy to have leaders from up and down the state come and join us today. Thank you very much.
Gracias.
Muchas gracias.
And good night. Healthy eating.